Welcome to the Quality Improvement in Ambulatory Surgery Centers, an open forum. My name is Sherry, and I'll be your operator for today's call. At this time, all participants are on listen-only mode. Later, we will conduct a question-and-answer session. Please note this conference is being recorded. And I'd like to turn the call over to Ross Gatsky. You may begin.
Oh, thank you very much. Hello, thank you for attending today, and welcome to our open forum, Quality Improvement in Ambulatory Surgery Centers. We all know that as ASC staff, you guys are putting great effort into projects and strategies to improve your quality of care, and we hope that what you learned today will assist you in those efforts. During the presentation, all lines will be muted. However, we will be asking for your participation, and there will be multiple opportunities to do so over the phone, through polling questions, and in chat throughout the call. So please be engaged. As more people that share, the more valuable that this discussion becomes. Our presenters today are Donna Modgers from MPro in Michigan, Sarah Brinkman from Stratus Health in Minnesota, and myself, Ross Gatsky from Medistar in Wisconsin. So just quickly, go over the objectives for today. After today's call, we hope that you can understand the changes to the ASC quality reporting program for the current and future calendar years, hear and share promising practices, lessons learned, and challenges related to quality improvement in ASCs, and also have the opportunity to network with ASC professionals from across the region, which is Michigan, Wisconsin, and Minnesota. This leads us to our first polling question, as we just try to gauge how familiar everyone is with some of the available resources that provide notifications about changes and updates to CMS quality reporting programs. So, among the group, do you currently receive reporting updates from the QualityNet listserv? And the options are yes, no, or if you may be unfamiliar with the listserv and wondering exactly what it is, that is quite all right as well. So we'll wait about 30 seconds for everyone to put in their answers for that. And while we wait, I'll just give a brief overview of what the listserv is to those that may be unfamiliar. QualityNet's listserv is a notification application used by the Centers for Medicare and Medicaid Services to send out important updates, changes, or alerts to quality reporting programs via email. Subscribers receive these notifications as soon as CMS releases the updates, so it's a great way to stay informed on the latest changes to the quality reporting programs, as in this case, the Ambulatory Surgical Center Quality Reporting Program. So, very quickly, we don't want to spend all the time on this. It seems like a majority of those who answered are familiar with the listserv, and there's only just a very few that aren't. And for those that aren't familiar with or not subscribed, to the listserv, this next slide just provides you with these simple steps to get subscribed to it. You just simply need to visit the QualityNet site at the address on this slide, enter the email address that will be receiving the listserv notification, and simply select the Ambulatory Surgical Centers checkbox under the Program Notifications section of the web page. And as I mentioned, it's a great resource. It doesn't require any additional work on your end, and it comes at no cost. And like I said, it keeps you up to date on important program changes and other updates that are crucial within the ASC quality reporting program. So with that, I will pass it on to Donna Modgers for the next portion of the presentation. So thank you very much.
Thank you, Ross. I would also like to thank everybody for joining us today. We hope that this open forum webinar is informative and useful for you. So just like all of the CMS quality reporting programs, the Ambulatory Surgery Center Quality Reporting Program has payment year submission and determination periods. And so I'd like to just start real quick just by reviewing the payment determination year payment determination year 2018 update. So the data that's going to be used for payment determination year 18 is calendar year 16 data that's going to be reported or submitted in calendar year 17. So we've given you here, it's a table which you've probably all seen before. They have this posted on the Quality Reporting Center. You can also access it through the QualityNet website. But this will assist you in your data collection and submission efforts. So if you look at this, we'll see we've also included a link for you. And so for payment year determination 18, the submission deadlines are as follows. Your measures 1 through 5, of course, are claims data that's submitted right on your bill. But ASC 12, which is a new measure, is also a claims data, but claims-based data, but it is new, so I wanted to point that out. And that is for the 7-day post-colonoscopy hospital visit for patients that are 65 and older. And that is due, you can begin submissions of that between January 1st and August 15th of 2017. Measures 6, 7, 9, and 10 are web-based measures, and you submit those through QualityNet, and they are due between January 1st and August 15th of 2017. Your ASC 8 measure, I'm going to go back to that because that is the healthcare personnel influenza vaccination, and that actually requires submission into the NHSN tool. It's a CDC tool, and that has a different submission deadline. For the flu season, it is due to for CMS through NHSN by May 15th, 2017. And then there's ASC 11, which is for the improved vision within 90 days post-cataract, and that is due August 15th if you voluntarily choose to submit that measure. So as I mentioned before, there is the ASC 12, which is a new measure, and this measure is actually based on unplanned hospital visits within 7 days following an outpatient colonoscopy. Again, for patients 65 or older, it's an estimated facility level rate of risk standardized all-cause and unplanned hospital visits. So this is all visits that happen after 7 days. Or within 7 days. The data is claims-based. CMS uses both your claims data and enrollment data for the Medicare beneficiaries in your state that are 65 and older. And CMS has actually provided several reports. There was a dry run report, and there were reports September of 2016 and December of 2016 for ambulatory surgery centers to work on their data. And also there will be another report coming out in March of 2017, so you want to be sure to look for that. And if you've not actually seen this report, or you have trouble accessing it, or you're not sure if you have one, you can go to the Quality Reporting Center and select the ASC topic, and then you can select the lookup tool for ASC 12. You can find out if your facility has a claims detailed report. And if so, then you need someone with the QualityNet access with the correct rights to be able to access that report on QualityNet. So I just wondered, some ASCs could use this to identify opportunities for improvement. You might be able to identify coding issues or quality of care issues. So what we'd like to know, while you are here, if we could pull up the polls there, we're going to have like 30 seconds to answer, but we just want to know if you've used this report, if you have found issues with it, if they're coding or not. You can have multiple answers to this, of course, unless you select the first option or the last option. But also, you know, we'd love to have you share any experience you've had with this claims detail report. If you found coding issues or quality of care issues that your facility is now using to improve the quality. And so I also would like to add, too, that CMS is planning to report this measure on Hospital Compare, I guess, the publicly reported, beginning with December of 2017. So I see we've got a lot of people that have not accessed this report, and several that have and did not find an opportunity for improvement. So that's good. So I guess if you have, I'm sorry, that last answer was going, so I apologize for that. But if you have found issues or you have looked at that report, if you wanted to share anything with us on this call, that would be great. You'd be sharing with others that may be able to, you could help each other. And so if now a lot of you have not looked at it, and I strongly encourage you to find that report and access it, because it really will help you get, you know, going on your improvement and identify what the case may be. So anyways, I think that is it for this ASC 12. So now I've actually given you a couple of resources also for, here we go, for the Quality Net and the Quality Reporting Center to go to for, if you want to find perhaps some previous events that the VICR, which is the Value Incentive Quality Reporting Center, or Quality Net have held, or anything having to do with the Ambulatory Surgery Center or Quality Reporting Program, you could find on these two websites. And now for payment determination year 2019. 2019 payment determination year will use 2017 data that will be reported in 2018. So the only and main update for this payment determination year is that your submission deadlines have changed. So if you look at this, you'll see we've also provided the link, and I've just zeroed in on here that the dates have changed. So you took prior to payment determination 2019, you had till August 15th for your web-based measures, but this time you will have to submit for payment determination year 19. You'll have to submit your web-based measures by May 15th, 2018. And so now want to make sure that you have all of your NHSN data for your healthcare personnel influenza data and your web-based measure by May 15th each year going forward. So anyways, I think that's all I have for you today on this, and I'm going to hand this over to Sarah now to talk about further updates.
Great, thanks, Donna. So the last thing we're going to talk about today is payment determination year 2020. As a reminder, that will be data collected in calendar year 2018 and reported in 2019, and then impacting payment for 2020. Unfortunately, we don't yet have a payment determination year 2020 version of the measure reporting data charts that Donna shared for the previous 2 years. But what we are going to talk about is the CMS released final rule. that came out November 14th, 2016, and it outlines requirements for the Ambulatory Surgical Center Quality Reporting Program, or the ASCQR, including updates to the program for calendar year 2020 payment determination year. And the first link on this slide will take you to the rule in the Federal Registry. So the ASCQR program is covered in Section 14 of the Final Rule. If you download a PDF of the Final Rule, you can find this section by searching for page 79797. The Quality Reporting Center hosted a webinar reviewing the Final Rule and the new measures on November 30th, 2016. And the second link on this slide will take you to the Quality Reporting Center's event page. From there, you can scroll down to find the November 30th event, which includes a recording of the presentation and a PDF of the slides. And we'll spend a few minutes now reviewing the measure changes, but please note that a specifications manual for these measures is forthcoming. So a high-level overview, the final rule lays out 7 new measures, 2 that will be collected via QualityNet as the CMS web-based tool. These are ASC13 and ASC14. And then 5 that are part of the Outpatient and Ambulatory Surgery Consumer Assessment of Healthcare Providers and Systems, or the OASCAP. The first of the 2 new web-based measures to be collected in calendar year 2018 is ASC13, or the normothermia outcome. CMS adopted this measure as a means of monitoring the rates of anesthesia-related complications in ambulatory surgery centers with the goal of reducing perioperative hypothermia and associated complications. So specifically, this measure will be reflected as the percentage of patients that having surgical procedures under general or neuraxial anesthesia for 60 minutes or more who are normothermic within 15 minutes of arrival in the post-acute care network. And we have a polling question for you. We are interested to know if ASC13 will affect your facility. Have you been tracking on normothermia for patients under anesthesia thus far? So the first option is that the measure won't affect you because you don't have patients under anesthesia for an hour or more. We expect that that will be the case for some of you. The measure will affect you and you have been tracking on normothermia rates, or it will affect you but you have not yet been tracking on normothermia rates. And for those of you that have been tracking on normothermia rates until this point, if there's anything that you'd like to share with us in the chat as to what you've learned thus far in your data tracking, we're very interested to hear from you if you've had any aha moments or any best practices that you've identified as a result of that. We'll wait here just a moment for the polling results to finalize. It looks like about half of you didn't respond, but of those that did, a majority are not expecting to be affected by this measure because they don't have patients under anesthesia for an hour or more. 5 are currently already tracking on normothermia, and the additional 2 that responded have not yet been tracking on that measure. So again, if you do have any best practices you could share with us in chat, or when we open up the lines at the end, we'll be interested to hear from you on that as well. So the second of the 2 new web-based measures to be collected in calendar year 2018 is ASC14, or unplanned anterior vitrectomy. And CMS adopted this measure as a means of monitoring adverse outcomes associated with cataract surgery. Specifically, the measure will be reflected as the percentage of cataract surgery patients who have an unplanned anterior vitrectomy performed. And again, we have a polling question for you. We're interested to know if ASC14 will affect your facility, and if so, have you been tracking on unplanned anterior vitrectomies thus far? So go ahead and open that poll. Your answer choices are that the measure won't affect you because you don't perform cataract surgery, that it will affect you and you are tracking on some form of measuring unplanned anterior vitrectomies, or that it will affect you but you have not yet been tracking. And again, we welcome you to share any insights that you have related to your data tracking and quality improvement efforts around this measure in the chat box. And when we open up the lines at the end, we'll be interested to hear from you as well. So while we're waiting for those poll results, it looks like, again, we've got a good number of folks who won't be affected because they aren't conducting that particular type of procedure. A number that are already tracking on it, and a few that will be affected but are not yet tracking on it. So So that gets us through our first two measures. Our next measure, we do have a polling question for you here. Before we move into a deeper discussion of the 5 new measures that will be captured through the OASCAP, we wanted to know, is your facility collecting patient feedback using a standard survey tool? So we'll launch that poll here. Your answer choices are no, we do not currently use a standard survey tool to collect patient feedback. Yes, we do use one, and we're using those results to inform quality improvement initiatives. Or, yes, we do have a standard survey tool, but we're not routinely using the results to inform quality improvement. We know that the purpose of those patient feedback tools is to inform quality improvement, but it doesn't always happen the way that we're intending. So we appreciate any honest feedback that you can provide us in this answer as well. And it looks like there are a couple of facilities that aren't collecting patient feedback, a couple that are but aren't routinely using it, and a majority that are collecting that patient feedback and using it to inform quality improvement initiatives. So this kicks off our discussion of the OASCAP. And so we'll move along here. And what are the OASCAP, first of all? So OASCAP stands for Consumer Assessment of Healthcare Providers and Systems, specifically for outpatient and ambulatory surgery. CAPS, if you aren't familiar with them, are a family of surveys that are funded and overseen by the Agency for Healthcare Research and Quality, or AHRQ. The CAPS surveys ask consumers and patients to report on and evaluate their experiences with healthcare and serve as a means for capturing comparison data across a specific setting of care, which is intended to be meaningful for patients. So many of you may be familiar with the HCAPs or the CGCAPs. HCAPs are those used in the hospital setting, CGCAPs in the clinic or group setting. You may have even been called following an experience at the clinic or in the hospital to provide your feedback. The OASCAPs have been specifically designed to capture feedback from patients seen in the outpatient and ambulatory surgery setting, and there's a link to the OASCAP webpage here for your reference. So what specific information does the OASCAP capture, and how does this translate into your ASCQR measures? So the 5 OASCAP measures for the Ambulatory Surgery Center Quality Reporting Program will be ASC 15A through ASC 15E. And in total, the OASCAP has 37 questions, and we provided the breakdown here. So there are 6 questions that make up ASC 15A, which are about the facilities and staff. 7 questions that make up ASC 15B, which include questions that relate to the communication about the procedure that the patient is having. 9 questions for ASC 15C, which are preparation for discharge and recovery. An overall rating of facility question, which is ASC 15D, and a would you recommend this facility question for ASC 15E. The remaining 13 questions are demographic in nature and standard across the CAP surveys. They're used by AHRQ to develop case mix adjustment models for the survey. As with all CAP surveys, there are strict rules about administration of the OASCAPs. It must be conducted with a random sample of eligible patients that have had at least 1 outpatient surgery or procedure in the sample month. And methods for collecting the CAP surveys responses include mail or telephone or a combination of mail followed up by a phone call. And the survey must be administered by a CMS-approved vendor. Further information regarding the format and timing for public reporting will be included in future rulemaking by CMS. As a reminder, OASCAP takes effect in payment determination year 2020, which means that your collection will begin in calendar year 2018, and the data is to be collected monthly and submitted quarterly with an expectation of a minimum of 300 surveys completed each year. So now we have a really simple polling question. We just want to know, does your facility have any concerns about implementing the OASCAP? Just yes or no. We know that this is new for you, although many of you are already doing patient experience or satisfaction surveys. The CAP surveys are different. They do have different requirements and different questions. We've heard some feedback from facilities that are wondering how they'll be able to continue with their current survey or the method of the survey. So we're just interested to hear from all of you. And we can see the results before we post them. Right now it's looking pretty split here. We've got 8 facilities that have said yes, we have some concerns, and 8 that have said no. So hopefully we can have a nice discussion here when we open up the lines in a moment and hear what your thoughts are about the OASCAP. I know, I believe we have someone on the line who's at a facility that was actually part of the field test for the OASCAP. So be interested to hear from them. So now we'll open it up for further questions and sharing. So this could be about things that we covered today or other topics related to quality reporting and improvement in ambulatory surgery centers that you're interested in discussing. We greatly appreciate any feedback you have for us so we can identify additional educational opportunities to better support you in your work, and would really love to hear from you about the topics we covered. Sherry, could you provide instructions on how folks could queue in on the phone if they'd like to share?
We will now begin the question and answer session. If you would like to ask a question, please press star and then 1 on your touch-tone phone. If you wish to remove yourself from the queue, you can press the pound or hash key. If you're using a speakerphone, you may need to pick up the handset first before pressing any numbers. Once again, if you would like to ask a question, please press star and then 1 on your touch-tone phone. Standing by for questions.
And Sarah, and while we wait for those questions to queue up, we do have a couple of thoughts in the chat. And one of the questions was in regards to ASC 13. In regards to tracking ASC 13, are staff members supposed to track from the anesthesia start time and end, or the surgery start time for the neurothermia measure? And I was under the assumption that the staff members should be tracking the anesthesia start time and end. And correct me if I'm mistaken on that.
That is my understanding as well, with the caveat that we don't have the specifications out yet. So
yeah,
we definitely want to defer to those once we have them, but just having an understanding of what they are hoping to address with the measure, I would lean towards that it would be the anesthesia start and end time. If the patient is under anesthetics for 60 minutes or more. Is that your understanding as well, Donna?
Yeah, I know there's no spec manual yet. That's why that's kind of hard to answer. So I actually have the final rule in front of me to see if they actually address it, but I'm going to keep searching and I'll get back with you if I find it. I'll let you know either way.
I have it.
Okay.
So this only applies to patients that are under anesthesia for 60 minutes or more. So given that line of thinking, it should be starting the anesthesia start and end time.
Nancy shared in the chat that they have found warming fluids for patients has helped with normothermia. Thank you for that, Nancy. Sherry, is there anyone on the line?
I'm showing no audio questions.
Okay. I would be interested to hear from folks on the line who, as Donna led us through the discussion regarding the claims report, if you have any input on how you've been able to use that information to inform your practice, and then any concerns that folks have regarding the OASCAP. We did have a number of individuals who indicated that they have concerns about the OASCAP. If there's anyone on the line who has experience with the OASCAP, whether through field study or having maybe reviewed that closer or working with a vendor that is planning to be able to implement them for you, we'd be interested to hear about that as well.
We do have one person in the queue. They did not leave their name, but if you queued up, your line's now open.
Hi, I think that was me. I'm Diane, and we were involved with the research a couple of years ago with the OASCAP, and actually it was with a company that we're currently working with our patient satisfaction surveys. What our concern is, it wasn't very easy to have two different companies. So what I mean is to have our regular survey and then to upload a certain percentage into the research mode for the OAS CAP. So I'm not sure how that's going to happen, if that will be any easier. The other really big thing is we're used to our surveys being administered for the majority of them via email, and OASCAP is unable to do that at this point in time. So that delay in your response and your results, I think will happen. So we also use our surveys as for quality, and our survey results also affect our employee bonuses. So that will be interesting to see what really happens with that. The cost of the administration of the OAS CAP survey is more than what we're used to also. We're looking at negotiating some pricing with that right now. So otherwise, the questions, I mean, it's a long survey. I'm not sure if there will be difficulty with patients filling that out just because of the length. The questions are okay. It's meant to be a total different type of a survey than what most of us are used to administering, but that's just my experience with it.
Great. Thank you so much, Diane. We appreciate your insights there. We did get a couple questions in the chat box about the OASCAP. So one was regarding do we have to have 300 paper surveys per year from the site? Is there a minimum? So the expectation is that you will have, they're aiming for at least 300. And the caveat there is that the paper surveys, you can do the survey over phone or via mail. So it could be paper or it could be a phone conducted survey, depending on which approach your facility chooses to take. As Diane stated, at this time there is not an email option for CAP surveys. And there was a question as well about facilities that perform patient satisfaction surveys via phone. So it is an expectation that you do need to, most hospitals that I am aware of and clinics that I am aware of that I've done work with, actually all of the ones that I've ever worked with, do work with a vendor to carry out their CAP surveys because the regulations and the requirements for sampling are so stringent. So in both of those cases, there has been an option for facilities to take on those requirements on their own. However, the burden has been deemed to be so high that they've always gone with a vendor in the experiences that I've had. So yes, there is an expense then that comes along with being able to meet that requirement. I don't know, Donna or Ross, if you know of any facilities of any type in your states that are doing any of the CAP surveys themselves as opposed to having a vendor?
Not in Michigan, I'm not aware.
Yeah, not in Wisconsin either.
No. There was just a general question about being new to reporting and wanting to know how to get started with putting in data. So, Josette, I would ask if you could share in the chat box where you're from, and then we can make sure that someone reaches out to follow up with you and help you figure out what the first steps are for getting started, or if you'd prefer, our contact information is listed here. Oh, so I see you're actually from North Carolina, so we will go ahead and get you in touch with the Quality Innovation Network that serves your state.
This is Donna. Also, I just want to get back to you on the ASC13 normothermia. So I think the question was, did the time start from the surgical incision time or the beginning of anesthesia? And actually, this measure starts once the patient gets to the PACU within 15 minutes. They want normothermia. So for surgery that is 60 minutes, the duration of patients who are normothermic within 15 minutes of arrival to the PACU is what they're looking at. So the numerator would be the patients with body temperature equal to or greater than 96.8 Fahrenheit within 15 minutes of arrival to PACU. The denominator is going to be all patients that underwent surgery with general anesthesia greater than or equal to 60 minutes in duration. And there was also a question about whether or not what the benchmark is, and I don't believe that I cannot find anything about benchmark yet, and maybe that will come after the measures being collected. But I mean, you know, the actual numerator being that the temperature greater than or equal to 96.8. Yeah.
In regards to the benchmark, I found something from the Becker's publication, for the ASC publication that they have, and they performed a survey, and the data is based from the ASC Quality Collaboration Quality Reports from the first quarter of 2016, and they got a benchmark for the ASC 13, which was at 97%. So I don't believe this is anything official that the CMS will use for their benchmarks or thresholds or anything of that regard, but I think that just gives you like an idea of where it might be.
Thank you, Ross.
Mm-hmm.
Yeah, so there were a few facilities on the call today that indicated that they're tracking on this, so I'd be interested if anybody's willing to share what you've found in the tracking of normothermia for patients under anesthesia for an hour or longer, what your kind of benchmark is if you were to look at having a performance improvement goal. Going back to the chat box, there was a question to any of those who are currently using OASCAP. Are you carrying on additional non-OASCAP patient surveying for the remaining of your patient populations? The expectation is to have 300 completed OASCAP surveys in a year. What are you doing with the remainder of your patient population, if anyone's willing to share? And Sherry,
as a reminder, if you'd like to open your line, you can press star and then 1 on your touch-tone phone.
Thank you. So this is really the goal of this webinar for us was to provide you with some basic overview information about the next few years and some changes in the ASC quality reporting program, but then also for us to kind of gauge what topics of interest you may all have and ways that we can better support you in the work that you're doing. So we really do appreciate if you can share with us in the chat or open up the phone line. I also want to remind you that when you log off of today's webinar, you will automatically be directed to a short evaluation, and we ask that you please take a few minutes to provide us with feedback about today's call and any suggestions that you have for future offerings. And then once you've completed that evaluation, you'll receive a certificate of participation for your record.
Yeah, I just wanted to piggyback off that, Sarah, and you brought up some good points. I know it's not always the easiest thing to share in a group with people you're not familiar with, but that being said, we just wanted to let everyone know that we are just trying to gauge what everyone's working on and what the focus areas are in regards to your ASC work. And we are available to be contacted via phone or email after this call, so feel free to open up and contact us, and we'd be more than happy to help. Because it helps us drive where the work is going for you guys as well, because a lot of times we're just trying to gauge the areas of focus, and that your feedback is always helpful.
Ross? Thank you to Julie Schmidt, who shared in the chat that their facility started tracking on measure ASC 13 in July of 2015, and at that time they were around 88 to 90% reaching the measure, and then concentrated on staff and anesthesia education on that topic, and have since been at 98% since January 2016. So that's a fantastic improvement initiative that they've had underway there. And James, I'm going to share the link to the slides here for you and everyone else who may be looking for them. So again, Julie, thank you so much for sharing that. It's great to have that example to look to. Nancy has posted some information about that same measure As folks are starting to drop off the call, we just want to reiterate, please don't hesitate to reach out to us directly. Please do complete that post-webinar evaluation. Julie says that she'd be interested in sharing data with other facilities that may have also started tracking. So if your facility has been tracking on ASC 13 and you're looking to be able to compare your performance with others or share ideas about improving outcomes, we're happy to help facilitate that in any way that we can. Julie, I would encourage you to reach out to whichever one of us is your state contact, and as others hopefully reach out to us as well, we can help make those connections.
And this is Donna in Michigan also. If you have not accessed your claims data report for your ASC 12, I think if you need any assistance, please feel free to reach out to us also, because I think that could be a lot of opportunity there. I assume you all had the dry run previously, but the more recent report and then the one that will be coming out in March could be of great benefit. So I strongly encourage you to start looking at those reports.
Well, with that, I think we can close out today's call. We really appreciate you all being with us and sharing your feedback. We're definitely going to go back and look at those polling results to see how we can help better help you into the future with these new measures that are coming forward. And we hope that you'll reach out with any further questions or suggestions that you have.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.